There's a fine line between being mentally sound and mentally ill. Those are the words of the Chief Executive Officer of the Mental Health Authority, Dr. Osei, at a dissemination exercise organized by the authority for the mental health policy launch in April this year. The exercise is targeted at assembling various stakeholders on their collective roles and also to understand the importance of their inputs in ensuring smooth implementation of the policy.
This policy was developed and launched in April this year, and having launched it, we now want to disseminate. In other words, people who will be party to implementing the policy are being brought together, so you let them know their role that they can play. They are the duty bearers with respect to the implementation of the policy. There are various stakeholders. These include, for instance, Ministry of Finance. Ministry of Finance has a big role to play in terms of ensuring that adequate financial resources are made to the Mental Health Authority. If the Mental Health Authority has adequate funding, then it can also fund out, give some to other stakeholders who will require to implement. Other stakeholders who will be implementing include the local government. Local government, for instance, the mental health law mandates them to be responsible for patients with severe illnesses on the streets that you may call vagrants. If you go to the cities, the towns, the villages, persons with mental illnesses are roaming about naked, unkempt, dirty, nowhere to sleep. And these are kith and kin, our own people. And their talents, as we all have, are locked up in them. And if we got them treated and we freed the talents, I keep saying one of them might have the solution to our economic problems as a country. So it is our responsibility to make sure that they are all taken care of. So local government has a big role to play in that matter. Gender ministry, is a ministry not only for gender and children, but also for social protection and the vulnerable. So mentally ill persons are vulnerable in the society who are required to be protected by all of us. So gender ministry is a ministry that leads in that social protection. So they have a big role to play in terms of the implementation of this policy. Again, they have responsibility for LEAP. Persons with mental illness also fall under LEAP, and we need to make sure that they are covered.
Dr. Osei has also been speaking about the high incidence of suicide.
There's another issue of high cases of suicide and attempted suicide. We want people to understand that, yes, you can be having challenges of any kind. If you realize that you are not as you used to be a few days ago, 3-4 days ago, now you cannot sleep well, you realize you are not as happy as you used to be, you sleep very little, you wake up, you feel like the world has come to an end, everything looks gloomy. You are having depression, which can lead to attempted suicide. Please seek help. If you also know somebody who is going through this, like he wakes up in the morning, he puts a chin in the arm, in the palm, and somebody may even say, I want to die. Don't take it lightly. Let's help ourselves so that we can reduce this incidence.
The Chief Director at the Ministry of Health, Kwabena Boadu Oku Afari, highlighted efforts by the ministry to contribute to mental health care in the country. He explained that the 2 new psychiatric hospitals are under construction under the government Agenda 111 initiative. He further added that government will ensure that all regional hospitals have psychiatry wings in order to improve psychiatric care.
We are trying to improve infrastructure in the health sector in general. And this has actually culminated in the creation of an infrastructure division within the Ministry of Health. We talked about Agenda 111 and indicated that specifically for mental health, there are 2 new psychiatric hospitals that are being built. And one will be in the middle belt, another one will be in the northern belt. The northern belt will be somewhere around Tamale, and the middle belt one will be somewhere close to Kumasi, so that people will not have to travel all the way from the north or the middle belt to come to Accra, because as at now, all the infrastructure, all the hospitals for psychiatry are located in the coastal belt. And I will say that very close to Accra, around Accra, we have Accra Psychiatric Hospital, we have Pantan Hospital, and the other one is Ankafo. We are also trying to ensure that all the regional hospitals will have psychiatry wings. Now, currently, there are at least 3 of them, Koforidua, Ho, and I think Cape Coast, which have psychiatry hospitals integrated into the functions of the regional hospitals. And as we go forward, we believe that infrastructure will be improved in such a way that all the district hospitals will also have psychiatry wings in order to improve upon psychiatry care.